Welcome back. We've been talking about non-declarative memory, autonomic nervous system responses, resourcing to take care of yourselves. All interesting concepts, I'm sure, but we haven't really talked about the therapy itself. Like, what are we even doing? What's going to happen when you come in to see me and we do some work together? So let's talk about that. What do you do in this therapy? This work is really about two things, comes down to two things. And the first one here, this is the secret sauce. This is the magic ingredient right here. Maybe other kinds of somatic therapy do something like this, but I've never come across it before. And this is really the coolest thing. It is a directive inhibition of coping. So what does that mean? Right now, every day of your life, you do stuff to cope. Maybe you feel a little sad, but you're at work. You don't want to cry at work. People are going to look at you funny. So you do stuff to not feel sad. Maybe you take a deep, calming breath. Maybe you get up and walk around the office. Maybe you just start fidgeting and biting your nails. Maybe you're at home with your kids and you feel a little angry. You don't want to be angry around your kids, so maybe you have a beer, or you fidget with your hands, or you just do stuff. And this stuff, these coping strategies that you do, they're wonderful for short-term symptom relief, but they're not so good at actually resolving these feelings. So what we're going to do in these sessions in a very specific container is inhibit those coping skills and see what happens. Sometimes you know what you're doing. I am going to take a deep breath so I don't feel sad. And sometimes it's some skill that you picked up a long time ago, maybe when you were very young, and you've been doing it for so long that you don't even know that you're doing it. It's such a procedural memory at this point. So it might just seem automatic, or it might be something you do on purpose, but there's a lot of coping skills that you have. So the question is, what if you don't do those things? What if we selectively inhibit all of this physical stuff that you do to manage your distress? So we're going to inhibit these distracting or coping skills that you have. We're not going to fidget or gesture or nod. We're not going to take deep breaths to calm down. And we're just going to see with an air of curiosity what happens if you don't do that stuff. This might look like me saying to you, easy with your hands, or slow down that movement. Or, oh, if you do one of these things, that's okay. That's a normal thing. You're trying to take care of yourself. So you take a deep breath. And then I say, what happened right before you took that deep breath, right? And I'm going to sound like a broken record. I'm going to say, slow down with that. Notice your breath. Notice your feet. Stop, or not stop, but what would happen if you don't wiggle your toes around like that? And I'm going to say, come back to the body. I'm going to say that 1,000 times. Just come back to the body. What are you feeling in the body when you're not doing these physical coping skills? So that's number one. That's like the magic thing, is selective inhibition of these coping skills. And that's going to create a pressurized container in which you can feel stuff. Then we just hold that experience. We don't really have to do anything about it. We just sort of create a place, a container, a state of mind where you can witness and feel and integrate these events and these memories and these body states that you haven't been able to feel or integrate before. So that's an emotional focus. That's saying, if you feel a little bit sad, maybe say that out loud. I feel a little bit sad. Just kind of track in your body, where do you feel sad? Do you feel sad in your eyes, in your chest? Is it a pressure? Is it heat? Is it cold? Like, what is that sad? Where is it in the body? And just allowing that to be there, alive in the room, and then sharing it with another person, me, it's kind of magic. It can do wonders. Sometimes you're going to get pieces of these event memories, right? Of a stressful or a traumatic memory. And maybe in the memory, which could have been a week ago, it could have been 30 years ago, but maybe in that memory, in the real world in the past, you said something or you thought something like, no, don't do that, or go away, or come here, or something about yourself like, I'm so stupid, or I'm weak. And I'm not agreeing with you, but I might say that again. Highlight or repeat the thoughts that you had back then. Do it again now. Say out loud, no, or stop, or I'm so stupid. Really, go into that. And that can really deepen the process. It's just going to bring bits of those event memories and the procedural memories and the autonomic activation, just going to bring that into the room with us in even more detail. So those are really the two things. I mean, it's easier said than done, of course. And I'm going to be there the whole time, witnessing and sitting with you and directing you. It's a much more active kind of therapy than I'm used to doing, to be honest. So I'll be there. You don't have to remember all of these things. I'll be there to guide you and notice when you're, gesturing or wiggling your toes, even if you don't notice it. And if it's too hard, if it's too painful, if it's too stressful, you can come out of it anytime you want. You just have to say something. You just have to take that deep breath. You just have to fidget and move around. And then you won't be in that pressurized autonomic state anymore. So now you've learned a little bit about memory and the nervous system and resourcing and how to do this work. I welcome any questions and comments. I really look forward to seeing you soon and working with you on this stuff.